Welcome back to Good Things Utah. We are talking about the 5 reasons why people would get rhinoplasty or a nose job. We have Dr. Douglas Henstrom here from Utah Facial Plastics. I'm so happy to meet you.
Great to be here. Thank you for having me.
Is now part of Dr. Scott Thompson's team, and we love him. And
Yes.
You've only been here a little bit.
Just got here about a month ago, but it's been nothing but great.
Nothing but fabulous.
Yeah.
All right, let's talk about the reasons why people decide they need a nose job.
Yeah, so it can vary. Some people may have one little aspect of their nose that they want tweaked or changed, like a bump on the top of their nose that they want to have it refined. Maybe it's the tip of their nose that they want more definition to. Maybe it's crooked. Maybe they've had some trauma to the nose that's made it crooked and they want it straightened. And then some people, it's all of the above. There's been trauma or other reasons it's crooked. There might be a hump on the nose. They need some tip refinement. They want kind of the whole package so that the nose fits their face better.
So I guess each procedure would be different, but tell us what's like going through a nose job.
Well, going through the process of a nose job, you come into our office, and our first visit, we're going to sit down and talk about what you want. What is it that you're there for? And we want to help you meet your needs, and we want to get on the same page with you as far as what you want with the nose. And then we're going to go through the process of fully evaluating your nose. We've got to look at not just the aesthetic or cosmetic side of how you want it to look, but is your nose functioning right? So in examining a nose inside and out and doing that properly is a very crucial part of getting a good result in the end.
Well, not only do sometimes people want it to change the look, but sometimes they have breathing issues. Can those be fixed at the same time?
Yeah, absolutely, and that's the best time to do it. And that's what will bring a lot of people into our office, is they come in with a complaint of not being able to breathe through either one or the other side of the nose, or possibly both sides of the nose for whatever reason. And so it's important to establish the right diagnosis. Why is a person not breathing well? And then doing something about that at the time of the surgery. Often they'll say, I can't breathe well, and we'll look and say, this is what we can do to help you breathe well. And then they'll also have an addition, well, while we're doing that, can we also change the look of the nose so it fits my face better, or do something about this aspect of my nose that I don't particularly like? And we say, yeah, absolutely, we can do that at the same time, and we should. That's the opportune time to take care of those things.
Well, there are different levels of rhinoplasty too, because I know sometimes you can just get it numbed a little bit and tweaked and you don't even have to go under, and other times it's a full-on surgery.
Yeah, exactly. So there's options when we take a look at a nose. We want to evaluate how much do we really need to do. And if it is just a little tweaking, there's options for what some people refer to as a liquid rhinoplasty. So that's just something in the office where we can use fillers, dermal fillers, to inject onto the nose or into the sides of the nose to balance it out and create a nose that the person really likes, whether it's just a profile look that they like and that they're after. That's one option. The other things to consider with the nose is, the nose is one part of the face, and when you look at it, you've also got to consider other areas of the face. For instance, the chin. Oftentimes, we will incorporate a chin implant at the same time as a rhinoplasty.
For balance.
For balance, exactly.
Wow.
So you want to do that for the best nose results. Sometimes you've got to look at other areas on the face to help those as well.
What kind of recovery time are we expecting?
Yeah, loaded question, because there's the initial phase of recovery, which is going to take 1 to 2 months for most of the swelling to resolve.
Okay.
However, the full recovery for a nose job really is going to take a year. And that means all the swelling is going to resolve, all the healing is going to take place in the nose. And so it takes some time. You have to be patient with the healing process of a rhinoplasty, just like any other surgeries that you're going to undergo.
But if I wanted to get rhinoplasty and decide how much work I should be taking off, what is that?
Usually a week.
A week.
You're going to have a cast on your nose for a week. You may have some stents inside your nose for that amount of time, especially if we've done some functional work inside the nose. So we generally tell people, plan to take a week off of work. Usually after that, and those stents come out, the cast comes off, people can get back to work.
That's so wonderful. And I know people think it's life-changing when they see their new nose that they've been dreaming about.
Absolutely. You know, quite literally, the nose is front and center in
our
face. And so undergoing that is a big decision for patients. They shouldn't take it lightly. They should make sure that they meet with qualified surgeons that have experience in doing this and that are able to not only diagnose their aesthetic concerns and help treat those, but not compromise their function. and be able to help the function of the nose so that continues to work for them as well.
Life-changing in so many ways.
So many ways it is.
Dr.
Absolutely.
Douglas Henstrom, thank you so much. UtahFacialPlastics.com. Their staff is unbelievable. I'm so happy you're here. If you're thinking about a nose job, then a rhinoplasty, you need to go check it out today. Go get a consultation and just see what you think. Thank you so much.
My
Nice
pleasure.
to meet you.
Thanks
Glad
for
you're
having me.
here. All right.